Welcome back to Midday Kentucky, everyone. Of course, Dr. Eric Smith is in the house he's a general and bariatric surgeon over there at Georgetown Hospital. And of course, he's brought Cindy Kaywood, the registered dietitian and licensed diabetes educator. How are we both?
Doing good.
Okay, let's just rehash why you're here and why it's important to have the dietitian. We talk about you being one of the best when it comes to metabolic surgery for fighting diseases of diabetes type 2 and also weight loss.
Sure.
When you go in to have this type of procedure, they do the consultation first. You come in and you sit down with the patient, you talk about the procedure, but then how do we bring in Cindy and discuss what we need to do afterwards? Or do they need to start the weight loss program beforehand?
Well, really, the first visit that they do after they've done the educational seminar and learned about the different procedures is we talk to them about appropriate dietary habits and exercise habits. And so that becomes part of their lifestyle from the get-go. And they may have 6 or 7 months worth of dietary education left before they're allowed to have surgery. So Cindy meets with them from the very beginning.
So Cindy, where do you start?
I start with their initial visit at the bariatric center, and I'll see them all through their process for the pre-op education, getting them prepared for surgery, and then I work with them afterwards as well, which I think is even more important because that's where you need to learn the tools and the skills to practice them to make sure you've got that support and accountability to be able to pull it off long term.
So are you giving them a meal plan, or are they coming in and getting food from you? How does that all work?
It's not a meal plan. The diet, it's pretty much based on a high protein, high fiber, lots of vegetables and fruits, just a good, healthy diet. Definitely focusing on the protein, but I think where it gets very individualized is in the how. So I'll go over the what, the why, the how of the diet.
Right.
But it's in the how-tos that most people need. So for example, if I've got a patient who's a stay-at-home mom, she's got 3 kids, and then I've got a patient who travels Monday through Friday. They're both going to need 2 different types of how-tos and strategies to figure that out. And that's kind of where I'm able to dive in and really work with them and make it individualized.
Dr. Eric, why is that so important to get the diet right?
Well, it's a lifestyle change. The surgery is only effective if we have lifestyle changes for patients. Obviously the surgery I do will help with portion control, but they have to fill up with the right foods. Eating less of bad foods long term will not be near as successful as someone who's filling up with the right foods. And we're trying to teach someone how to eat the correct way.
And this is one of the procedures that we're talking about here and showing what actually happens.
Yeah, that's a video or an animation of a sleeve gastrectomy, which is the most common procedure that we do. It's a restrictive procedure, so you can see the patients are going to fill up much quicker because the stomach is smaller, it holds less food.
So when you say portion control, and this is where I want to bring you back in again, Cindy, is when you say portion control for after this has been done, is there certain foods that you can no longer eat? Because there is a lot of misconception out there. People think you can't eat oil, or you can't eat chilies, or, is there some sort of issue with that?
I mean, you can eat anything that you want.
You just
can put
can't
anything.
eat a lot of it.
Exactly, and then there's certain foods that are going to make you feel more full. So those are the foods that we coach our patients to have, and that's using the tool how it was meant to be.
Yes.
So,
and very quickly, Dr. Eric, is when you have this type of procedure, what are some of the issues? Now, of course, diabetes 2 is going to be decreased, yes?
Yes, absolutely.
What other very side effects can be a benefit of having
So,
this?
the common medical problems that we'll see resolve is type 2 diabetes, hypertension, obstructive sleep apnea, some women who have polycystic ovarian syndrome. But if you think of hypertension, diabetes, and sleep apnea, you'll see upwards of 85% or more of those people are cured after weight loss surgery. So those are medical problems that go along with their obesity. And we'll see those things correct oftentimes before they've lost a significant amount of weight.
Well, and this is what I love about you, this little stat. You've done well over 1,000 surgeries of doing this, saving people's lives, and we appreciate that as well. If you want to find out more information about Dr. Eric Smith and Cindy, of course, Georgetown Bariatrics and Advanced Surgical Gynecological Services. There's all the information up on the screen now. Give them a buzz or head over online, because I have to tell you there's some great information on there for you. Plus, they also have that online, is it a tutorial or is it?
Yeah, it's an online seminar that gives them all sorts of education about the procedures.
Put your mind at ease before they give you a call.
Absolutely.
That's what it's all about. We really appreciate it. Hey, still